Welcome to Medical Marijuana and Wellness. Today's topic is dosing with medical marijuana. Dosing is absolutely critical to getting the most out of your medical marijuana experience. And more importantly, proper dosing will not only help you get the most out of your medical marijuana, but also save you some money. I'm joined tonight by a couple of co-hosts that are going to help us be able to explain this. A couple of representatives from Surterra, and of course, Nurse Amy Green. So let me start with our Surterra co-host, Forrest. Welcome back.
Hey, good evening, Mark. It's great to be back here again. I am Forrest Haag. I'm the product marketing manager for Surterra down here in Florida. And tonight I'm joined by Danielle, who's from our Largo store. I'll let her introduce herself. We're also excited to be here tonight again. We'll be doing another giveaway tonight, so pay attention to some of the topics. And by the end of the webinar, we'll be asking another question for a chance to win $25 store credit. So Danielle, why don't you introduce yourself?
Hi there, I'm Danielle Carapellucci. I'm the Assistant Ops or Operations Manager in Largo, Florida. I've been with Surterra for about 5 years, and I have a background in behavioral health and nutrition and wellness, so this all kind of correlates and has all evolved to be where I am today. I'm super stoked to be here, and I love that we provide this opportunity for you all.
And you're our local star in our advertising.
And yes, that was totally me. Yes.
I thought that was your picture. Well, welcome. Thank you for joining us. And not to mention a very important co-host, someone who's helped me put together the videos, not only for this, but a number of other events that we've done. Amy Green, a nurse at a medical marijuana clinic in Villages. Welcome, Amy.
Always great to be here, Mark.
And thank you very much for helping me put together this video. I know it's very important. I do want to mention to everybody, this video is being put together for information purposes. Naturally, if you have any questions about medical marijuana, consult your doctor, your medical marijuana doctor or practitioner. But dosing is really, really key. And I think it's important that we really understand it, because not only will it help you get the most out of medical marijuana, but also can save you some money. So we'll have a video that we put together. Right after the video, we'll actually show you products that you can use. I know there's a lot of talk about the theory of dosing. We'll actually talk about dosing and some of the products that can be used, and then also we'll answer any of your questions. So let's get into dosing. Here's a video that we'd like to show you. Welcome to Medical Marijuana and Wellness. Today's topic is dosing with medical marijuana. Very important subject to get the most out of your medical cannabis experience. Joining me today is Amy Green. Amy, thank you for joining us.
Of course, Mark. It's always nice to be here.
Let's talk about dosing. What we're really trying to do is get the most out of the cannabis products that we're buying. Tell me about the different components that we're trying to take advantage of.
Yeah, certainly. So cannabis itself is made up of several different parts. There's going to be 3 major ones. You'll have cannabinoids, and there's big cannabinoids like THC and CBD. Then you have terpenes. Terpenes are what give cannabis its smell and its taste, and are also giving it a lot of the beneficial components. And then finally, you have flavonoids. Flavonoids also contribute to color, taste, and the smell of the product, and they're also bringing in a lot of really helpful benefits as well.
Yeah. And the amazing part about cannabis is by combining all 3 of those together, you're getting something called the entourage effect. These are where they work together to enhance really the medical efficacy of the product itself.
Yeah, absolutely. So when you combine all of these different parts of the cannabis plant together, they are working together to give you the most benefits. So that's why having THC on its own without terpenes or flavonoids isn't necessarily as beneficial as having all 3 together.
Sure. And so we're talking about dosing. So let's just jump right into it. One of the fascinating parts about cannabis is it's biphasic.
Yeah, and so this means that you can have too much, and it means that we're trying to find a therapeutic dose. So what I mean by this is, as I am increasing my dose, there is a spot in that line of increasing it where I have the relief that I'm looking for, but without unwanted side effects. And if I go past that sweet spot, there are possible negative side effects from having too much cannabis.
Right. And your physical size doesn't make any difference. I mean, you can be very small and have a high tolerance of THC. You can be very large and have a low tolerance of THC. It really just depends on your metabolism. Is that correct?
That is so true. Yeah. And it really depends on how you use cannabis. So if you consistently use lower dose products, you're going to have less of a tolerance than somebody who's using high dose products.
Sure.
Uh,
Now, here's a great example of, we talk about combining both THC and CBD together. Here's a study that really made this, that makes this point very clear.
Yeah, and so in this one, the THC only group is using approximately 27 milligrams of THC daily, while the CBD and THC control group, they were using approximately 60 milligrams total of both of those compounds together. However, the group that was using CBD and THC together had superior reduction in pain. So this is really showing how powerful putting CBD and THC together can be.
Sure. And that's really an important point to be made. Now, what we're trying to do is find our sweet spot. What is the sweet spot?
Yeah, so as I said, it is finding the lowest effective dose to allow you to have the benefits that you're looking for, whether that is anti-anxiety, anti-inflammation, pain relief, whatever you are trying to treat with medical cannabis, it is the lowest effective dose without unwanted side effects. And that side effect that we're usually trying to avoid is that stoned, heady feeling. We actually don't want you to get to that point. We want to try and find that sweet spot before you get to that point.
Yeah, what you're really trying to find is what your tolerance is to THC. So let's talk about that a little bit. There are different factors that control, as we mentioned, that control how much cannabis each of us takes. It has to do with really our bodies and not necessarily our size, because pharma drugs will just be prescribed based on weight, but cannabis is a little bit different. It really has to tie into a number of different things like your metabolism and medical condition.
Certainly. And like you said before, it does not matter the size of the person. It's completely based on how that medication is working for that patient. And often we'll say what's working for one person is not guaranteed to work for another person. And this is why, because you have so many differing factors from person to person. A big part of that is your endocannabinoid system. That's the naturally occurring cannabis system in your body. Your body naturally makes cannabinoids. And when we are using cannabis products, we are supplementing that system. And how our personal endocannabinoid system works is absolutely going to differ from person to person.
Right. And the route of administration, meaning how we take it, the amount of dose, the cannabinoid content, all have a factor here. We'll be talking a little bit more about this as we go along. But you talked about titrating up and actually titrating down. Explain that to us.
Sure. So when you are titrating a dose, this means a dosage change. That's all titration means. So we always want patients to start at a very low dose and then slowly work their way up until they are actually in that target range where they're having relief with no side effects. Now, when we say toxic range, what we mean is it is a non-therapeutic dose. You've passed to the point of having the relief that you're looking for, and you can actually have unwanted side effects. That may be a return of pain, that may be anxiety, that may be that stoned, heady feeling, but that is a non-therapeutic dose, and it means you need to titrate your dose down to bring it back into that target range.
Right. I mean, one thing about cannabis that's interesting is more is not better. And that's what we're really trying to show out here is you take it, you may not necessarily feel, let's say, the relief that you're looking for. And also you may get some negative side effects, which is what you talked about earlier. It's down here.
Yeah. And when we talk about negative side effects, they really kind of fall into two different groups. So you have your mild negative side effects. That might just be a fast heart rate, dry mouth, red eyes, dizziness, anxiety, or that couch lock feeling where you don't want to get up and do anything. And then you have the more severe side effects from using too much. That might be some paranoia, difficulty standing, that overwhelming sense of just the world is too much for you. and then difficulty staying awake. And again, these are all effects that we're actually trying to avoid by finding the correct dose.
Sure. And that's so when you start feeling, especially when you get over here, that's why go low and go slow is important, because you'll probably experience some of the mild side effects first before you get to the severe ones. And so as you begin to feel that, just back down, take less of the product. You're not going to necessarily, in fact, what it'll do is it'll help you get the relief you need, but to avoid the side effects. And this is really the key to dosing. That's what makes dosing really important. Really key is to understand listening to your body. Your body will tell you when you're beginning to feel relief. Your body will tell you when you're not feeling good. I know a lot of people say, well, give me a formula. Tell me what I should take. Give me how much of this, how much of that. Really, we can't do that because you really have to listen to your body. Every person's body is different. Some people, for example, you take alcohol or caffeine. Some people take one drink and they're kind of done for the night. And some people could drink the whole bottle and they're just getting started.
Mhm.
With cannabis, you really have to find out where your tolerance is to THC. Once you do that, then you can increase the amount of CBD and you can get yourself into an area where you can actually find that, what they call that therapeutic dose. So listening to your body is really, really key. There is no formula that a doctor can give you. It's not like take 2 pills and call me in the morning.
And that is exactly right. Now, since the last slide did say toxic dose, we just always want to reiterate that there is no chance of overdose with cannabis. You will get that high, stone, heady feeling that will go away with time, but there are no lasting impacts, and there's been no overdoses ever with medical cannabis.
Sure. I mean, you'll feel uncomfortable, but you're not going to die. I think that's the key. A lot of the pharma drugs that are out there, it's amazing to me, especially when you're watching TV, they tell you all the side effects, and the last one is always you're going to die. I mean, from eye
Certainly.
drops, that really is amazing. But anyway, the point is, no one has ever died from the use of cannabis, either medically or recreationally. So I think that's fairly safe. You may feel uncomfortable, but it's fairly safe with respect to the death area. Now, we talked about going low and going slow. Explain that to me.
Yeah, so again, it's just starting very low and then slowly building up to a point where you actually have the relief that you're looking for. So when we are working up to that optimal dose, we are looking at how much THC we're using, how much CBD we're using, what terpenes, so the smell and taste of the product that has been beneficial for us.
Mhm.
And then there's just some things to consider as well. So we know that cannabis compounds can be stored in the fat cells of the body for 30 days or more.
Mhm.
That does not mean, though, that you're going to feel the effects for 30 days or more. That just means that the byproducts of using cannabis are going to be stored in your body, but without giving you any effects.
Mhm.
The other thing is cannabis loves fat. So we actually always recommend using cannabis products with food, and with a fatty food is even better. Something like peanut butter, yogurt, something that has a good amount of fat in it.
Right.
And then
It'll help you. It'll help you quite a bit. It'll help you bring out the benefits of cannabis when you use that.
certainly. And then this is what I love, journaling to know what cannabis products you've taken, how often you're taking it, what dose works best for you, and really looking at a full 24 hours for yourself. Do you need to take something morning, noon, and night? Or with your symptoms, do you only need to take something once a day? And this is really where it depends on the patient.
Right. I think also we recommend that if you're titrating or you're using THC or a combination of ratio of THC, it's important to have a bottle of CBD around.
Certainly. The nice thing about CBD is it does not have any psychoactive effects to it, and it will counteract the psychoactive effects of THC. So if you take a dose of THC that gives you that heady, uncomfortable feeling, taking an equal amount of CBD can help bring down that headiness and just make it more comfortable. All of the effects are not necessarily going to go away, but it will definitely be more comfortable than having that high, stoned, heady feeling.
Right. I think that's very, very important. Is that we call that a rescue product. So
Yes.
So let's talk about the process that you go through. I know you usually a lot of people start with a tincture oil using a 1-to-1 ratio. Why don't you walk us through this? Because this is very, very important. Really, our
It is.
goal is to start at about 2 milligrams of THC, and walk us through this because this is not complicated, but it is a process.
It is a process, yeah. And this is just determining how concentrated the tincture that you're using is. So the idea is you want to find out how much of that product you should be taking to get the benefits that you're looking for. But in order to figure out how much you're supposed to take, you need to do just a little bit of math. So say, for example, your the packaging of your tincture says that there's 250 milligrams of THC in that bottle, and that bottle contains 30 milliliters of liquid. So you're going to divide 250 milligrams by that 30 milligrams, and you have roughly 8.33 milligrams of THC per milliliters. Now, if I wanted to start at 2 milligrams of THC for my dose, I would be using approximately a quarter of a dropper. Now, the concentration of your tincture might be different, and the volume of that bottle might be different. And so it's just really important to have both of those numbers, both how many milligrams of THC are in the bottle total, and then the actual volume of that bottle. If you have those two numbers, you will be able to figure out how much you should be taking to get to that starting dose.
Right. It's not overly complicated. It's just there is a process where you figure out the milligrams per milliliter, and then that'll translate into how much of the eyedropper to start with, especially if you're starting with a titration product like a sublingual type of thing, which I recommend is the place to start. It's probably the easiest to control. But, you know, we'll talk about other routes of administration as well. Now, you talked about journaling. I think that's really, really important. Tell us a little bit about that.
Yeah, so when we talk about journaling, we want to objectively look at how the product is working for us. So when we are looking at our journal, we want to know what product we're using, how much we used, when we took that product, when we started feeling effects from that product, how long those effects lasted for, what symptom relief we had, and then would we use that product again? Was it effective for what we were trying to treat? And then when you go back and look at how that product worked for you, you can see, well, I took this dose, it lasted this long, and it was moderately effective for me. So I'm going to slightly increase my dose and try again with another journal page and see how that dose works for me.
Right. And this is very effective. I know it is a bit, how should I say, tedious to be able to write a lot of this down, but it really makes a huge difference to be able to know day after day. Again, you're feeling a little bit better, but why are you feeling better? That's the key to journaling. It's there.
Absolutely.
Now, there's some tips we have, so to make it a little bit easier, we have a journal that you can download. There's a bit.ly link down here. And by the way, you'll get that in the email follow-up to this particular video. But here's a key. Talk us through the different parts of this journal.
Yeah, and so this is just looking at using a product from the very beginning. So it's how you're feeling beforehand. And there is a section there for any symptoms that you're experiencing. So say your problem that you're trying to treat isn't necessarily from pain, mood, or anxiety. Say it's something else, it's a little bit more specific. Just write down how you're feeling. And then you're just going to note the product, again, how much you took, when you took it, the time that you first felt the effects, and then did it help with what you're trying to treat. One
Right.
part of this journal that I especially like is that there is a section in the very center that's duration. So that's how long that product is going to last for you. This is really important information when you're looking at a 24-hour treatment plan. So if you know that this product that you use works for 6 hours for you, then you kind of have an idea, okay, so about every 6 hours, I should be taking a dose.
Sure.
And that's,
I know
that's
in
how
my particular case, I have herniated discs in my neck. I have 7 of them, which is a lot of pain. And I know that, like, for example, the sublingual drops I take in the morning, they say they work between 4 to 6 hours. In my case, they work for about 4.5 hours.
Mhm. Yeah, and that's establishing the duration. Once you have that information, it's a lot easier to make a long-term plan of what's going to work for you.
Sure, it's there. Okay, so let's take a look at, again, once you find that sweet spot, once you say, okay, I'm listening to my body says I'm beginning to feel better at this particular point in time, you can actually increase the amount of CBD that you use to be able to really enhance the, let's just say, the efficacy of the cannabis product you're taking.
Certainly, yeah, because THC and CBD work better together. Once you found your therapeutic dose for THC, by adding more CBD, you're not reducing any of the effects from the THC. You're just increasing the benefits from the CBD while also probably reducing any headiness or unwanted stone feeling that you may be experiencing.
Yeah, and I know in my case, I found that by increasing the amount of CBD, so I'm using a product that's a 4-to-1 or an 8-to-1, that reducing of inflammation, which is what CBD is really known for, reduces the amount of pain. I found that it's not just a matter of going after the pain itself, it's going after what's causing the pain, which is the inflammation. And by reducing that, it really helps quite a bit. And that's what a lot of people will find, that increasing the amount of CBD will probably help them get better relief. Now, let's talk a little bit about the routes of administration. We talked about sublingual drops over here. There's also other ways. For example, some people may want to start using gummies, edibles.
Yeah, so gummies are a very popular way to start just because they're very easy to dose. Generally, I always recommend starting with a quarter of a gummy. Wait 45 minutes to an hour and a half to see how you feel with that dose. And if you're not feeling anything from that dose, it's okay to take another quarter, but that's going to be your dose adjustment for that day. The next day, when you're taking a full dose, you could actually start at a half of a gummy instead of the quarter, because you've already established that a quarter of a gummy is not going to be effective for you.
Right.
And like that, you can increase or decrease the dose based on how you're feeling.
Sure. And also, topicals really aren't a really good way to start figuring out your dosing level because they act so quickly. But inhalation is. Some people could try using either concentrates, flower, or an inhalation vape pen.
Certainly. The biggest thing with any vapes or concentrates, generally the standard dose is going to be a 3-second inhale. I would usually recommend starting with a half second or 1 second inhale. Wait 5 to 10 minutes to see how you feel with that dose. And then if you need a little bit more, have another half second or 1 second. And again, the idea is going up in very small steps to find that area where you're comfortable without unwanted side effects. There is a chance with a vape that if you did the whole 3 seconds at once, that you're going to go from like 0 to 100 as quick as you can. And that's very uncomfortable.
Sure, that's really there. So let's talk a little bit about terpenes. I know this is a very busy slide, and I really don't want to go through all elements of it, but I think the important part is to understand that each of these terpenes has a different property that can help you with pain and inflammation, mood, that type of thing. And they're also very sensitive to temperature. This is really, really critical because when you're, for example, when you're vaping, most vape pens will have 3 or 4 settings. It's important to set the setting on the lowest setting. For example, if you're trying to use things like myrcene, for example, or linalool.
Certainly. And this is why knowing what terpenes are in the product that you're using. So if I'm looking for something that's going to elevate my mood, I might be looking for products that have limonene or linalool in it, or even terpinolene. It's finding those terpenes that are specific to what you're trying to treat. That's really what drives a lot of the benefits from cannabis is the terpenes.
Right. And notice most of these say low or low to medium heat. I think that it's key that when you're going to look at inhalation, get a vape pen or a device that lets you set the temperature. Because if you take that blunt, you take a joint, you put that 500-degree temperature flame to light it, you're going to burn off most of the cannabinoids, almost all of your terpenes, and a lot of your flavonoids. You're going to reduce the medical efficacy quite a bit. But by using a vape pen with a temperature setting or a concentrate with temperature settings, you'll be able to get the maximum relief from your inhalation product. So let's talk a little bit about the timing. I know in my particular case, I have herniated discs in my neck. It's not going to go away. I've got to have something that works all day. And a lot of people ask me, what's my regime? And I think this is important because what I do when I wake up in the morning is I have a vape pen. I will take one of those hits right away to really get rid of the pain almost immediately. You had some comments on the word hits, right?
Yeah, so hits, it's just another word for a dose. And again, it's finding that low dose that works well for you.
Mhm.
Again, start with like a 1/2 second or 1 second inhale.
Right.
Once a patient is more experienced using a vape pen or a concentrate pen, they're going to figure out what the timing is for that hit or that dose for them.
Right. And then then what happens is I keep the pen with me. I don't necessarily need it just in case, but also in the afternoons and in the evenings, I use tincture oils to be able to, again, I might get about 4, maybe 5 hours. And so I have to make sure I'm covering it all day long. If I just took it in the morning only and didn't do anything later on in the day, the pain will come back. And then in the evening, I actually take a tincture oil that helps me get sleep through the night. And then also I use chocolates because the chocolate will last for 10 hours and helps me sleep through the night. So this is kind of my regime that I go through because I have to, again, I have to cover 24 hours a day. I wish I had a condition that I could only had taken in the morning, but unfortunately that doesn't go away. You see that quite a bit where covering the entire day is important.
Absolutely, especially with things like pain. It's not going to go away unless you're treating it, and that includes while you're sleeping. Is your pain waking you up while you're sleeping? Okay,
Right.
so let's look at a product that's going to help you with staying asleep.
Right.
If you are having pain when you first wake up, okay, let's look at an immediate use product like a vape that is going to give you the relief that you need right then. And then maybe
Right.
taking a tincture to give you a little bit longer relief. And then
Right.
looking at when you're going to take your next tincture dose based on how long your tincture lasts for you.
And it's really key. You really need to personalize it. The nice part about cannabis is once you identify your therapeutic level, once you understand your tolerance to THC, by experimenting with the amount of CBD, you will personally feel much better. Your body will tell you. There's nothing that a doctor really can't prescribe things. Your body will tell you when you're feeling good, and it'll tell you when you're not feeling good. And then you can get, and you, like I did, I wrote this down, what worked for me, and then I just follow it. Now I do where I have the 1-to-1 tincture oils I talk about here in the afternoon and evenings. I do sometimes go to a higher concentration of CBD, especially lately. The last month or two, I found that really helps quite a bit. So really personalize it. That's the key to dosing. So Amy, we talked about a lot of subjects with respect to dosing. This is really important, and I can't stress more. Personalization is really the key. What's your final thoughts on this?
Yeah, just remember, start low, go slow, be consistent with journaling, especially in the beginning. It's going to give you a lot of really helpful information about how products are working for you and also how long they're working for you. And then you can use that journal to help build a regimen for that whole 24 hours.
Right. This is not complicated, but it is a matter of doing a little bit of experimentation. It could take a week or two to really get it right. But I can tell you, once you feel it, once you see it working, it makes a huge difference. I'd like to thank you for watching this video. Naturally, follow us on social media. You'll find copies of this video and other videos at our YouTube channel, Marijuana Aware. And naturally, each week we have our Marijuana Aware webinars on Wednesday nights. Please join us for the different webinars that come out there. Thank you for joining us, and we look forward to your comments. Danielle, do you want to tell us a little bit about, I mean, the question that people have is, where do I get these? Where do I find these? And I have to tell you, not a lot of dispensaries have ratioed products. Tell us a little bit about Surterra, because you do a great job in this area of providing a bevy of products that people can use to help them identify their sweet spot.
Absolutely. We have a plethora of wellness products here. I lost my camera there for a second. Sorry about that. Like Amy was saying, really just utilizing your journaling, figuring out what your needs are going to be, and then going from there. So if you were to start with a high CBD product, which is not listed on here, we do have a calm product, but we have the Serene listed. That's a 5-to-1. That is a beautiful way to introduce some CBD. It's a beautiful daytime formula. And when you come in for your consultation, or you come into any of the Surterra locations and you want to discuss this, we have so many page products that we can give you, flyers, different information. It is a lot of information. And I think the biggest fear is it's just overwhelming. So writing
Well,
things down
I
is
think
going
one of the
to be
nice things
so
is you
important.
have a one-to-one product, and you have a couple of one-to-one products. You have your Soothe and you have your Revive. That's kind of a
Yes,
good place to start. This, the
that
Soothe
is
is more relaxing, more of an indica, where Revive is more of a sativa. But then once you find your therapeutic dosing level, you can increase the amount of CBD, for example, by going to something, just some like Serene products and things like that. And then also,
exactly.
if it's pain issues, you can go the other way with potentially increasing the amount of THC, right?
Exactly. The 1-to-1 is a perfect ratio balance to start with. And you can start with super small doses, like Amy was suggesting, a 2 milligram. We use 30 milliliter, 300 milligram bottles here. So it's a lot easier to do the math on that. So that part there is a little bit easier as far as Surterra dosing goes. But your 1-to-1, you
But
have
I think
two
it's also
different
important to
types.
point out that Surterra, you have certificates of analysis, COAs, that you
Yes,
can look
yes.
at for the products, and that'll tell you the amount of grams of CBD and THC in the product.
Exactly, exactly. And the 1-to-1s, as you were saying, we have the two different ones. We have Soothe and we have Revive. Those are both, they can be used exactly in the same day. Amy had talked about timing, and timing is probably one of my biggest tips for this, because to have an all-day coverage, you really have to figure out your timing for your products. So the 1-to-1s are beautiful because you can use the Revive during a daytime. The terpenes in there are a little more uplifting, and there is pain relief as well. We call that coffee in a bathtub here because it's like a little boost, but it is a really nice pain reliever and body relaxer as well. And then the Soothe, that myrcene and terpineol, that is just yummy goodness there. That is a beautiful evening, nighttime formula. And you can layer these. Your layering and your timing is all going to be dependent on how your body works and how your tolerance is with everything. And then, like Marc was saying, if you find the 1-to-1s are maybe a little too much, then bump down to a Serene or use a lower dose. The 1-to-4 is a beautiful bump up from the 1-to-1s. That Zen formula is, it is really named quite well. I love it for yoga. I love it for creative flow, social experience, and just calming the chatter, all that like calcification in your mind, that Zen just kind of
Well,
really makes it a beautiful
I think some
experience.
people have an active mind. I mean, I come from an environment. I come from a high tech environment where I grew up, where we had a lot of people that had very active minds. I have one, for example, and I know that Zen product does help me just calm myself, get into the, as you mentioned, the zone. You do yoga, I do Tai Chi. I find it works very well for that.
Yes, absolutely. Absolutely. Allows a little focus, doesn't let the mind drift so much. And it's just a yummy experience. And then you can go on up to your relief and your dream. Those would be our heavier THC, more nighttime experience. Definitely start super low with those. The relief is, they're both a 1-to-9, like I said, 1 CBD to 9 THC. The relief is going to be formulated more for pain, and dream is obviously formulated more for sleep. You can see the list of terpenes there. They're very, very similar in terpene structure. It's just the amount of terpenes that have gone into there. So that myrcene is really kicking in the dream. And again, you can use your timing and layering and incorporate that dream right into your regimen for the day.
Yeah, I found Dream works very well for people that have trouble sleeping. I've used it on occasion. I have also found some chocolate as well, but and I should also mention you carry chocolates at Surterra, and I like them. I like your dark chocolates.
The dark chocolates are my favorite as well. That formula is just creamy goodness.
Yeah.
And I like what Amy had said about the vapes as well. Knowing that 3-second inhale is the max, we always say eliminate the Mississippis. It's a, 1 second, 2-second draw, not 1 Mississippi, 2 Mississippi. So it's like taking a breath.
Yeah, no, exactly. That's really the way to go. So listen, we've covered it. I know you have a number of products. I recommend a lot of folks take a look at Surterra. I'm going to mention one thing before we leave that slide. You also do consulting. In other words, people can come to Surterra. You can book a session, and you'll actually sit down and work with people on what products would work for them, and actually help people figure out some of where to get started with dosing.
Absolutely, and that's probably one of our best features with Surterra, because so many people are so not sure where to start. They may have a stigma with it. They may not want to discuss it openly. We have private consultation. We can sit with you in the main lobby area and consult whatever is most comfortable for your situation.
Mm-hmm. Great. So we had some questions that were, thank you very much. And I recommend everybody take a look at it. I really don't care if you're new to medical cannabis or if you're a user for a while. I found consultations to be very, very helpful. It really helps ground you as what you're using to really help you with your particular quest for relief. Let's go to let's start looking at some of the questions. One of the questions is, can you please explain about the milligrams in a dropper and a half amount potency? This really depends on the bottle and the product. Is that correct, Danielle?
Yes, it is. Like I was saying, our droppers our bottles are 30 milliliter, and they are 300 total cannabinoid use. So it makes it very simple to use. My tip with this would be, if you're using a tincture, to use it against a white surface so you can see the lines, whether it's like your cupboard or a paper plate or your husband's undershirt, whatever it might be. But I don't know if you can see it here, but when you use the white background, you'll be able to see the segmented portions of the dropper itself, and it will help you a lot more with dosing.
Right. And again, the COAs are on the side of the, you can get the COAs that help you figure that out as well.
So with that particular bottle, you would have your 20 milligram would be a full dose, would be a full dropper.
Mm-hmm.
It would be 30 milligrams if that were a dropper and a half.
Sure. That really helps. One great question. I think this is a very good question. Microdosing versus dosing. What's your thoughts on that, Danielle?
Microdosing is I think the key to this, because it really is more of a microdose that's making it medicinal, because you can have your full dose, but that may not make it a functional dose. That might be great to go to bed with, so you can shut everything down, but it's not going to allow you to be functional. So that microdosing, even in high pain situations, taking just a small amount of that is going to help you out. And I can't say enough good things about the microdosing. And again, it's going to all be, there isn't a cookie cutter approach to any of this. It's all going to be personalized.
Yeah, and I might point out the microdosing is where you use a little bit of the product all day long rather than using it 2 or 3 times a day. It's much like athletes that when you're working or you're competing, you may eat 4 to 7 times a day rather than 2 or 3 meals. It just helps your body be able to absorb the food, in this case, the cannabis. So in this case, microdosing really helps quite a bit. It takes a little bit of discipline, although patches help quite a bit in that area.
Yes, and that's a great analogy with the that you had there, Marc. Yeah,
I know that when I competed, this may sound crazy, but when I competed, I used to literally eat 7 times a day, and I found I performed a lot better. It really did make a difference. Question is, how can I microdose and still be able to work? I think it really depends on your route of administration. I know that microdosing actually keeps you from getting the negative side effects of a lot of the cannabis. That really helps in that area. But I think the question is, in a workspace, it's really hard sometimes to be able to use tinctures or even smoke. Your thoughts on that? Your thoughts on that?
No, I think you're absolutely right on with that. It definitely depends on the route that you're using. It depends on your tolerance. It depends on the product. Everything is gonna come into play for that.
Right. And it's just unfortunately, cannabis is still a prohibited Schedule I drug in the United States, and you got to kind of work around that. I don't think there's any magic formula for that, but I do think that microdosing really helps. It helps when you're working because, again, it just stretches things out. This is related questions. As a brand new product, I'd love to learn how to dull chronic pain and anxiety during the day, but still be able to work remotely. That is exactly my problem. I have, again, 7 herniated discs in my neck, 2 in my back, and I still have to function on a daily basis. I think dosing for me was the key. Once I found my therapeutic dose, I was able to keep my pain at a level below 1 and still be able to work. This is something I think you see quite a bit, isn't it, Danielle?
It really is. And let's not forget the topicals in this as well, because
Good
someone
point.
that's just experiencing pain and is working from home, it could be just that sedentary experience that they're in for work, and just a patch or some balm or something may provide the exact relief that they need. But
Right.
with someone that has the amount of spinal fusions that you have, Mark, you would need probably a patch or something topical along with a
Right.
tincture or a longer acting.
Right. I mean, I use the topicals mainly, especially when things act up a little bit, and they do, unfortunately. One question is, I have a hard time figuring out how to stay ahead of pain. I haven't gotten much help. What can I do to figure that out? I think that again, once you find your therapeutic level, you can actually, in my particular case, I know I have to pay attention to using something in the morning, because I know that if I use tincture drops, for example, 4 to 6 hours later, they go away. In my case, about 4.5 hours. I've just got to plan my day. And so by doing that, I'm actually trying to stay ahead of the pain. Do you have any thoughts on that, Danielle?
No, I think you're absolutely correct. And it's all timing as well. That microdosing, doing it small throughout the day. And again, I have questions for this person, but it's really going to be everything is just so personal. Everything is just all about how you're going to process the medication, what you're doing in your day, what the pain is stemming from. And, is there anything else that you can do as well? Do you need to get up and stretch? Because sometimes just moving can help. But staying ahead of the pain is all going to be timing and your dosing.
Right. And I think also one of the things to pay attention to on that question is, if you attack pain by itself, that's one question. That's where THC comes into play. I found I had a knee replacement operation. Again, you want to have some pain, go get a knee replacement. And I found that one day I ran out of my THC product. So I increased the amount of CBD product until I had a chance to go to the store and go to the dispensary, get some more. I found out my pain level went down. And it dawned on me, my problem was inflammation, not just to attack the pain. And so I think when you want to get ahead of the pain, especially if you have herniated or you have surgeries or you have something like that, increasing the amount of CBD might help as well.
Absolutely. CBD is liquid gold. Everyone should be on it. Everyone should be using it.
Yeah, because again, I love when people say I use CBD and it gets rid of the pain. CBD is okay for pain, but it really is great for inflammation. And really what you're doing by reducing the inflammation is you're reducing the pain. And I think that's important when you take a look at medical cannabis. It's very, very important. So again, I think to get ahead of the pain, again, I don't know your particular condition, but you might try some CBD, because if it relieves or reduces the amount of inflammation, it's going to help you quite a bit. One question is, does tolerance increase in all time, and what steps should be taken to lower it? This has to do with taking a holiday. You want to explain that, Danielle?
Yes, abstinence makes the heart grow fonder. Yes, it does. A cannabinoid reset is really good for that. Also, another thing that you can do besides just taking a little break from it is switch it up, switch your products up. Shift out of some high THC, do a little bit of CBD, help just reboost some things.
Yeah,
And
your body,
I think,
your body it produces endocannabinoids, and if it starts seeing phytocannabinoids coming into your body from the cannabis, it gets a little bit lazy, and it can get lazy, and that's where really you have to increase the amount of CBD to be able to get it to work by stopping. And they tell you when you take a holiday to take 4 days off. Now, in my particular case, with 7 herniated discs in my neck, I get about a day, might get a day and a half, and then my neck taps me on the shoulder and says, if you don't do something pretty quick, you're going to know I'm here. So I get about a day and a half. But when I do that, afterwards, the next day when I go back to using cannabis, I find it's much more effective, and I need less of it to get the same amount of relief. And that's really what the holiday really does. It helps quite a bit with that. So, next question. Sometimes I just keep smoking and smoking. Is there a point that you don't get any higher? I think that depends on the person. Your thoughts on that?
well, I think there's many people have tried to prove this over and over and over.
ask Willie and Snoop Dogg, right?
But why are you smoking and smoking and smoking? Like, are you still trying to relieve some pain or get to sleep? Like, why are you still smoking and smoking? Just to see how high you can get? Or, like, that would be my question there. But in my personal opinion, and as far as using with that, I would say that, yeah, you plateau at some point. It's not going to go any further, and you're probably just wasting your product.
Right. And I think the thing about cannabis versus, let's say, alcohol just puts you out and maybe be life-threatening. Cannabis, you kind of keeps you at that level, and you may not get as much of a kick from it as you were before, but it's not going to kill you. That's the thing that's important. It's not going to put you in danger. May make you a little uncomfortable, but it's not life-threatening. Other question is, if someone is an ultra-rapid metabolizer, would dosing be different or more frequent? I think dosing is dosing. Your thoughts?
Well, with the ultra rapid, when they're working with that, I believe what they want to do is stick with the 1-to-1s and larger doses, smaller increments, as if I remember that correctly, because they're burning through it so fast. Right. So,
Amy, do you have some thoughts on this as a nurse?
Yes, thank you.
Yes, sir. So I would always just recommend using a journal in this specific case, because it's going to give you the most information for how long the products are working for you, and how long you can expect them to last for you. If a person is an ultra rapid metabolizer, we can expect that products are going to not work as long, but what that exact length of time is, we really can't say unless we're tracking how long that is.
Right. But again, your body will tell you what you do and you don't use. I know that some people do metabolize quicker than others, but again, your body will tell you if cannabis is working and at what level what your tolerance is to CBD and to THC. So I think, is it more or less? I don't know. I think your body's going to tell you that. We would guess more, but again, I have a friend of mine who has a completely opposite reaction to THC and CBD. CBD gets him high and THC relaxes. And it happens in about 2% of the people in the world. So again, you might want to take a look at that. That might be a factor as well. Next question. I use marijuana for sleep and anxiety, but I've never gotten much euphoria from it. I do not use it that often. So what's up with my tolerance? I think some of it has to do with when you say don't use it, you don't use it that often. If you use it on and off, you'll kind of get a different reaction than if you're using it constantly. Your thoughts on that, on that, either Amy or Danielle?
Well, first, I'm curious what products they're using. That would be my biggest question, because there's so many factors, as we know. Is your liver just processing it? Is it edible? Is it a tincture? Are you smoking it? If you're smoking it and you're not getting much euphoria from it, that I would say would be a product issue.
Yeah,
Yeah,
that could be.
I would also say, is euphoria the goal that you're going for? Because if the person is using it for sleep and anxiety, is the euphoria something that they want or that they don't want? And that's where finding a specific dose is really important. If you are looking for that euphoria, higher dose THC. If you're not looking for that euphoria, higher dose CBD.
Right. There. Next question that came up is, I want to stop using 3 and 4 products to sleep. Currently, I vape CBD, eat a chocolate edible, which has 25 milligrams of THC, and take 2 capsules with 30 milligrams of THC.
Wow.
Well, I think you can kind of, I think you can get down to 1 or 2, if not 1 product. Amy, this is really a kind of a dosing product about milligrams. Your thoughts on that?
Sure. So I think you have to look at the total amount of THC that you're using, how long each of those products is actually lasting you. And is your problem staying asleep or going to sleep? If it's going to sleep, it might be a timing issue. If you are trying to go to sleep and you're using these products to help fall asleep, and you're not taking them close enough to when you actually want to go to bed, say you're trying to go to bed at 10 p.m., you know these products are going to take 45 minutes to work. So you want to be aiming for like 9 o'clock, 9:15 to take those products, so that by the time they're working, it's giving you that heavy body feeling, which is really great for sleep. However, if this person is using the products to help stay asleep, they could probably use just 1 or 2 products and figure out which one is helping them stay asleep the most.
Yeah, I know that in my particular case, the herniated discs in my neck respond very nicely to a CBD type product because it relieves the inflammation. And when I relieve the inflammation, it reduces the pain. Reducing the pain helps me sleep. So I know that the CBD regime is important to basically reduce that pain, but I also know that using something like a chocolate edible will give me that. And by the way, that's the CBD products that I'm using, which would be a tincture in this particular case, will only last about 4 to 4.5 to 5 hours, where the edible, the gummy, the chocolate will last all night. So I use a combination of a tincture drop and also the edibles. And by the way, I want to throw a great compliment for the Dream product, because that helps you fall asleep as well. I think that's something to pay attention to.
And just to interject with that, going back to, do you need to fall asleep or do you need to stay asleep? If it's falling asleep, maybe switch that CBD vape up for a Dream vape or something a little higher THC or something with more myrcene in it to get you to sleep. And at the same time that you draw on that vape, take your chocolate or your capsule, because once that vape is going away, that chocolate or the capsule's kicking in, we have that whole entourage effect happening.
Good point. This is, what is the recommended dosing window to ensure good sleep hygiene? I think that really depends. Again, we go back to the onset of the product and the duration of the product. Amy, you want to explain a little bit about that? Because onset and duration is really important, and I think this fits into that dosing window concept.
Absolutely. And like I was saying, you have to look at if you're using a product to help fall asleep or if you're using a product to help stay asleep. And that's really where timing is important. So if you know that a product is going to take 45 minutes to work and you're trying to fall asleep using this product, you know that you want to take it about 45 minutes before you plan on going to sleep. But then when you have the feeling from the product, you absolutely have to go to sleep. Now, if you're trying to stay asleep with using a product, I usually just recommend taking the product at the time that you're going to bed. And that way, by the time it's kicking in, it is helping you to stay asleep.
That makes a lot of sense. Okay, let's talk about how is dosing strength and potency measured differently between flower, vape, and edibles? I think 2 milligrams is 2 milligrams is 2 milligrams, but the question is how to find it and how to handle it. Amy, you gave a good example using tincture drops. You want to kind of translate that into flower, vape, and edibles?
Sure. So when we have products like tinctures or edibles, we know how much of that product is in the dose that we are using. So say, for example, we're using a 10 milligram edible. I know I'm using a 10 milligram edible because that's what the packaging is telling me. When you have a product like flour, it's a little bit harder. And that's just because you have to look at the overall THC percentage of that product. Is there CBD? You have to look at the terpene profile of that product. It is not an exact one-to-one comparison between the two. And that's probably the hardest thing. So flour and vapes, harder to get a very specific dose. And that's why I always recommend just starting at a very low dose, taking short inhalations, and then waiting 5 to 10 minutes to see how you feel with that dose. It's just, they're not directly comparable.
Sure. It's a different way of they're measuring it, but you're measuring it in a different way. And so because of that, using a go low and go slow method will help to be able to help you figure out exactly that therapeutic level that you're looking for. And again, there is no translation equivalent is the best way of putting it. That's safe to say?
Yeah, it's just that, like I was saying, with an edible or a tincture, you know exactly how much of the product you're going to be using based on the dose that you're taking. But with flower vapes, it's more based on how it's working for you right then. Or if you've already established that, say, a 2-second inhale of this particular vape gives you the effects that you want, then that is the dose that's appropriate for you. But establishing how much THC was in that particular inhalation, that's a lot harder.
Right. There's a good question, excellent question here that came up. How can I select the right product and dosage levels for fatigue? And I think when you say the word fatigue, the question really boils down to, what do you want to accomplish? If that fatigue you want to translate into getting you to relax and, let's say, fall asleep and calm down is one thing, or is that fatigue something where you want to become a little more energized and be able to get a little bit more work done? One of them is, if you want to get more energized, you're looking at a sativa type product, sativa leaning, I should say, type product. Or if you're looking at getting more relaxed, more of an indica leaning. Your thoughts on that, Danielle?
Yes, absolutely. It definitely depends on what your focus is, what you're trying to accomplish, where your tolerance is. I would go low, definitely, and look at your terpenes. Your terpenes are where everything, that's a key, that's a secret to everything.
Right. Very, very good question here. It comes up. What are some safe dosing tips and steps for minor patients? Children tend to be able to take a little bit more cannabis than seniors or older people. Let's put it that way. However, I think the process is fairly the same. Amy, do you want to talk about that one, because I think that's really, really important.
Certainly. So I think this is a perfect example of, you need to start at the lowest possible dose. Yes. And then work up to a dose that is effective for the condition that they're trying to treat for that minor. It also depends on that minor's ability to communicate with the person that's assisting them, how they're feeling, how that product is working for them. And there has to be a lot of really good communication between the adult that's assisting them and the minor.
I can't emphasize that more. I've dealt with some minor patients, not as many as obviously adult patients, but I find that the key for working with minors is also having them be able to communicate what's going on without having them feel guilty. They can say, I'm uncomfortable, or I'm getting heady, and not have that be a negative. Not look at it as a negative. Look at it as, by knowing that we can help you. I think that's really an important part. Having them feel that feedback is safe. That we're really looking at helping them, not criticizing. I think that's really key.
Absolutely. And I would also say that I think having that open communication, if the adult is asking them, how are you feeling? Maybe adding some qualifiers to that. Are you feeling tired? Are you feeling pain if they're trying to treat pain? Be more specific with the questions that the adult is asking, just so that you can get the best information that you can out of a minor patient, especially since some minor patients might not have the ability to express things in the same way as adults. So it's really that open and thorough conversation.
Right. Here's a question: dosing information for patients with epilepsy. I think the same formula applies: go low and go slow. We know that epilepsy works. We know that cannabis works very well for epilepsy. The famous CBD products have helped quite a bit. Your thoughts on that, Danielle? Because I think we really follow the same process. The question is just a different product, or different set of products. Put it that way.
Absolutely, absolutely. And the one-to-ones, I know just from testimonies here, the one-to-ones do great with people that are dealing with epilepsy, and just staying with that timing and keeping that level across the board.
Right. I think it is very, very effective. But again, go low and go slow, and especially if you're dealing with epilepsy with teenagers and with children, it has been very effective. But again, make sure that you're getting that, understanding that therapeutic dosing level, because it can really help them quite a bit. And you really want to make sure you're providing the relief you're aiming for. Another great question that comes up: dosing with astroparat. I'm not going to be able to pronounce that correctly. Or other digestive disorders. Avoid edibles, capsules. Amy, do you want to take that one? Because I think this is important from a medical standpoint.
Sure. So gastroparesis is when the stomach is not emptying like it's supposed to be. That process is either slow or it's stopped. So when you have patients that don't have the same digestion as other patients, you have to think about their route of administration a lot more. Is that person going to be able to process an edible or a tincture in the same way? Is it going to stay in their stomach? Is it going to go into their bowels so that it can be absorbed and go through the liver? They may do well with more inhalation products or inhaled products, like a metered dose inhaler or a spray. They might do better with just different routes that cut out the gut.
Right.
Yeah.
Right. And this is where tinctures, for example, come into play. Yeah.
Certainly. And because tinctures do offer some sublingual absorption, which is under the tongue, it may also be effective for a person that does have gastroparesis. It's just going to take trial and error to figure out what that patient can tolerate. And what they find works for them. Because again, what works for one person is not guaranteed to work for another person.
Right. And things like topicals, stay away from things that get absorbed by the gut, like topicals, tinctures, things like that could help quite a bit there. Can cannabis be prescribed to persons in hospice care? Now, first of all, in the case of cannabis, we really don't do prescriptions. What they do is doctors will give you what they call recommendations. They'll recommend you use certain products. And then, of course, we work with the patient to be able to find their therapeutic dose. I know that some hospice, it really is a matter of really two things. One is the person open to it? And then this other question is, if the person is open to it, does the hospice care center allow you to do that? Your thoughts on that, Amy?
Sure. So just like you said, it's going to depend on the hospice organization, whether or not they will assist that patient or family with administering the product to the patient. Specifically in the state of Florida, if a person is on hospice, they can actually have more than one caregiver, and that caregiver can be a hospice worker. That's one of only two situations in which a person can have more than one caregiver. But again, it does come down to will the hospice allow it? Many hospices are federally funded and federally regulated industries, and so you have to think about the logistics of that. So really it comes down to, is the hospice going to allow it? Is there somebody to assist the patient if they do need assistance? And then just making sure that that patient is receiving the products that they need if the hospice and the patient are good with it.
Yeah, unfortunately, when you get in the case of hospice, you're crossing really two hurdles. One is with what product you use. And then, of course, the other question is what the medical care facility will allow you to use. So you have two different hurdles to be able to overcome there. Next question is what restrictions should be kept in mind for those who are in their 70s who take other meds? For those of us in the 70s, cannabis is very effective. And I think the only other meds you really need to worry about are meds that have to do with blood thinners. Is that correct, Amy?
That's correct. So the one that we worry about most would actually be Coumadin, or warfarin is another name for it. And when combined with cannabis, there is a chance of extended bleeding times. What this means is that the patient needs closer monitoring of their Coumadin or warfarin levels. And so that's a conversation that they would want to have with the physician that prescribed that medication to them. Just being open and honest with the physician that, hey, I'm using cannabis products and I know I'm on warfarin. Maybe we should talk about more frequent Coumadin level monitoring just to be safe.
Yeah, I think that makes sense. But in general, other than that, you really shouldn't have too much difficulty using it with other medications. Best CBD products for sleep. Again, I think this goes right back to each individual having which product. I do know CBD products come in broad spectrum, which means very little, if not any, THC in it, and then some that are what they call full spectrum, which has 0.3% THC or less. My guess is I would go with a full spectrum product rather than a broad spectrum product. Your thoughts, Amy?
There we go. Okay, sure. So I usually would say look for full spectrum products. Make sure that the product that you're getting is coming from a trusted source. With CBD products, since they are legal in the United States over the counter, it comes down to getting it from a trusted source and then finding a product that you can tolerate. If you buy a tincture and you think it's disgusting and you're not going to use it, it's obviously not an effective product for you. You might find something like an edible or a vape to be easier to use, or you prefer it more. So in the end, it really is personal choice.
Sure, that really makes some sense. Very good question here is, does cannabis help more for certain types of cancer or evenly across the board? We did a cancer webinar a couple of weeks ago, and on it, we had some video clips from a lady by the name of Dr. Cristina Sanchez, who is one of the leaders in the world in studying cancer and medical cannabis. She was very explicit that different types of cannabis work differently different types of cancer respond differently to different types of cannabis. For example, she recommended for breast cancer using, for example, higher CBD products, where with other cancers which have harder tumors and things like that, a higher THC product. It really depends on the cancer itself. There's a lot of different types of cancer. And again, because of that, it's a matter of really finding the dosing, getting your dosing right. I do have to say, if cancer is one of your issues, pay also attention to a FSO, a full spectrum product as well, because that'll help you quite a bit. Any thoughts that you might have on this, Danielle?
My first thought was the FSO. So I'm so glad that you brought that up. But absolutely. And I love that you brought up the CBD with breast cancer and the density of the tumors, because I know there's so many studies just exploding with that.
Yeah, there's a lot of studies being done around the world. Now, I want to point out that here in the United States, because cannabis is a Schedule I drug, there's virtually no research being done on cannabis and cancer. Now, that doesn't mean there isn't. In fact, there's probably more research being done on cannabis and cancer than ever has been before. Dr. Cristina Sanchez had a lab built for her by the country of Spain 26 years ago now, and she's been studying breast cancer and cancer, plus other forms of cancer as well. She's got about 1,200 studies that are out there, but also Montreal, I should say, McGill University and in Canada has been very active in studying cancer. That's one of the things that Canada is really homing in on, using cannabis and cancer. And I know the Israelis have done a tremendous amount of studies. So again, there are differences in how cancer responds to medical marijuana. and it really are the types of medical marijuana. It depends on the types that you have and the strains that are there. And I would say really, you might want to experiment with a few things, do some consultations, and then find some people that really know about cancer and cannabis. The Cancer Society, by the way, is doing a lot of work right now here in the United States and identifying various types of medical marijuana that can help with cancer. And that's probably a good resource for you as well. Any thoughts you might have on that, Amy?
No, I think you really covered it well. It's just going to depend on what works well for that patient. And we just need more research. And I love that Canada, Israel, Spain are really leading this charge because they have a lot more liberal policies towards cannabis than we have in the US.
Yeah, I know that one of the Canadian researchers believes that he can actually get to a point where in Canada they can really address, they'll be able to address cancer within 5 years using medical cannabis. So we'll find out if he makes that claim good. But I like the aggressive nature that they're taking. One other question is, any dosing suggestions for cancer patients who are NED, meaning no evidence of disease, after radiation and chemo, receive frequent scan watching and waiting? I'm a big believer in FSO products for cancer. And I think that when you talk about what dosing suggestions, I would continue a regime of full spectrum oil, FSO. Now, that being said, I look at FSO or full spectrum products as being much like 151 Bacardi. They're some of the strongest products that are out there. So you don't necessarily need to take that much of them. But I think my mother, for example, was diagnosed with cancer 5.5 years ago. And we put her on a regime that actually reduced her cancer to the point where she's in complete remission now. And I have her on a regime of FSO and have been for 3.5 years to be able to really address any cancer that might come back. And so far, knock on wood, we've been able to be successful. Your thoughts on that, Amy?
Yeah, I think it's just finding a maintenance dose and a maintenance product that works well for you and that you can tolerate. Once you are cancer-free or no evidence of disease, you have to look at what are your goals now. Are you going to be treating pain that you have from, chemo or radiation? What are your goals afterwards, and kind of go from there. Yeah.
Right. I think that's something that's there. Another good question. Suffering from fibromyalgia, what dosage is recommended? I think it still goes back to our formula: go low and go slow, and find the products that work. I think in the case of fibromyalgia, you may want to pay attention to, again, some CBD products that help quite a bit, because higher ratioed CBD products to really address the inflammation and really address the neuroprotective properties. Your thoughts on that, Amy?
Yeah, I would absolutely agree with you. I think it's finding the right ratio that works. Like Danny was saying, start at a 1-to-1. Maybe more CBD works well, maybe more THC, but it is going to be trial and error to figure out what works really well for you.
Right. I love the next question. It says, I'm facing multiple joint replacement surgeries soon and want to avoid narcotics due to side effects. How about medical marijuana? I can absolutely relate to this. I have had my right knee total knee replacement twice and my left knee replacement once. My right knee replacement because I had it done when I was in my 40s, because my knee wore out, and again the joint wore out. I had to have it redone. I can tell you that medical marijuana worked. I was part of a group that, when I had my knee replacement, I told my doctor that I didn't want to use. I wanted to minimize the use of narcotics. They loved it. I was working with Jewett Orthopedic here in Orlando, and they were looking for people that wanted to experiment with medical marijuana because they wanted to see if it was an effective treatment. I worked with my medical marijuana doctor ahead of time, came up with a regime. I think I showed you in the video the regime that I put together. I did have different ratios. At that time, I had higher concentrations of THC in some of the products, but I was able to take my pain level literally from an 8 or a 9 when I was in a hospital. I was operated on Monday. I took narcotics on Monday, half a day on Tuesday. I stopped Tuesday night. Wednesday, I took nothing except for when I got released from the hospital after 12. I went into the garage, took some tissue drops as well as hit a vape pen. And literally by the time my wife drove me out of the garage and onto the street, my pain level was down to a 1. And I've been able to keep it that way ever since. So the answer is yes, medical marijuana is very effective. Now, in my particular case, I was hypersensitive to paying attention to what my therapeutic level was for THC. And then one of the things I found out was, as I mentioned, I ran out of my a lot of THC products when I went a higher concentration of CBD, and found that worked very well, because in talking to my doctor, it was very obvious inflammation was what I was going after, not just pain. And by reducing that inflammation, it reduced that pain quite a bit. Danielle, have you seen people using cannabis for joint replacement, and what's been your
Every
experience?
single day, every single day. Yes, absolutely. And don't forget the topicals. Like
Oh
the
yeah, that's a
topicals
good
are
point. Yes,
beautiful in this. Yes.
yes, yeah, yeah. You don't put it on the incision itself, but you can put it around, and again, that works. That it did work wonders. That's a really good tip.
Yeah, and our patches, don't forget, our patches they go completely systemic. They don't break through the blood-brain barrier. So you can put it on a veiny part, like the inside of your wrist or your ankle, and it'll go systemic for you. So
That's an excellent point. Yes, that's an excellent point. Next question is, I've never used cannabis. How do I start? And will it help my chest pains because of surgery? I think we hopefully gave you the formula to start. And I think that I would also highly recommend go to Surterra, get a consultation, and talk to them to really help you understand cannabis, what can be used, and what products can really help you with that. And can it help you with chest pains? I think absolutely. Your thoughts, Danielle?
yes, absolutely. And why are the chest pains though? What is causing the chest pains? Is it a physical? Is it anxiety? What is causing the chest pains? But absolutely.
Right. I hope that helps quite a bit. But the answer is yes. And it's because of surgery, most definitely. What's the best edible for depression? Indica helps some, but I don't know how to dose it. I think that this is kind of interesting. This really relates to the terpene profile. And I have to tell you, not a lot of edibles, you can find the terpene profiles. Your thoughts on that, Danielle?
So we have COAs for all of our products, so you can find the terpene profiles there. But absolutely, indica, there are some terpene profiles in indica that help. Myrcene is one of them. Linalool is another, but limonene and pinene, they're probably the top two that are really successful in just shifting that depression and just lifting the spirit and giving you a little boost.
Right. And I think, again, paying attention to the terpene profiles help quite a bit, because what you're really trying to do is, you saw in the terpene chart, they talked about mood. Pay attention to the terpenes that address mood, like lemonade, things like that can help you quite a bit. Next question. I'm trying to tamp down anxiety during the day. Currently, sativa capsules are not doing a good job. Well, sativa is uplifting. And I think if anxiety is your issue, it's going to probably heighten your anxiety. Your thoughts? I think you want to look at more of an indica leaning product. Your thoughts on that, Danielle?
I would probably go more of a 1-to-1. Start there, see how that works for you. But yeah, unfortunately, sativa tends to be a trigger for anxiety and can make you kind of spiral focus.
Right. What strain is best for anxiety, for depression and anxiety, and also which is the best for mental health issues? Again, this goes back to the terpene profiles. Your thoughts on that, Danielle?
Absolutely. Absolutely.
Yeah, I think that you're really looking for the products that have the terpene profiles, again, that address, again, the mood that you see that's in there. And I think there's, again, my recommendation, I can go right back to it, is do a consultation, identify very specifically the products, and put together a journal and follow a journal to find out how that works. I think that'll help quite a bit. Is there any success with dementia and Alzheimer's patients? Yes, there's been 2 really good studies that's come out in the last year on this. Amy, your thoughts on this?
Yeah, I think it depends on what you're trying to treat. Cannabis is not going to stop or reverse the symptoms of dementia, but it can help slow down the progression of the disease.
Mhm.
So you have to look at, are you trying to help the person maybe have more of an appetite? Are you trying to have them gain weight? Just be more alert during the day. You have to look at what the goal is, and then go treat it from there.
Mhm. Yeah, that's really there. One other really good question is, what's the best way to use medical marijuana for central pain syndrome? Amy, you want to take this one because they're asking whether higher THC is better for pain control. And I do have to tell you, I found that if inflammation is causing the pain, CBD is not a bad way to go.
Mhm. So the interesting thing about central pain syndrome is that it's actually due to some damage to the central nervous system caused by something else, whether that's a stroke or another process that has damaged the central nervous system. So what product to use or what the best way to use it, it's just going to depend on what you can tolerate. So again, if you're not going to use a product, then it's not going to work for you. If you don't like tinctures, then don't use a tincture. Finding the product that works for you is just going to take trial and error.
Right. And again, when you ask this, does the higher level of THC mean better pain control? Again, like I mentioned, I found out that inflammation was my enemy. And by using a little bit more CBD, it helped me with my pain. Now, that doesn't mean that if it's not an inflammation-related pain situation, THC might be able to help. Again, this is that individualized dosing that you really need to pay attention to with medical cannabis. Good. When will topical product be created specifically for menopausal symptoms? I'll kind of let you take this one, Danielle.
So I'm not real sure about a topical product there, but this is going to go back to your terpenes. Your limonene for any menopausal libido, all of that is just beautiful. We really need that daily, just to keep that, plateau. There's the myrcene as well is also good, because the myrcene will kind of, one thing with menopause and stuff like that, especially if you're having any libido issues, is you get all in your head and you are your worst enemy in your head. So that myrcene is going to calm that down, where the limonene is going to boost your mood. And there's just some beautiful health aspects to all of that. The calming of the system itself, just allowing your body to relax and be present in the moment instead of everywhere else.
Great. What's the best strains for Parkinson's, not smoking it? Parkinson's, again, gets back to really a lot of its negativity comes a lot from the inflammation part. I think products that really have a terpene profile that address inflammation, I think, help quite a bit. Your thoughts on that, Danielle?
Yes.
Maybe Amy, that would be a better question for you. I'm sorry.
I think either of us could take it. As far as best strains or products, I would actually defer to Danny, just because if they're wondering about specific products that might work that are not smoking specific, I think having somebody that is in the dispensary could give more detail.
Right. I know I've worked with the Parkinson's Association here in Florida, and we've talked a little bit about we found that the products, again, it depends on the patient itself. I cannot stress more, every person is different, but we did find in general, a number of the products that had a higher ratio of CBD to them was helping quite a bit. Danielle, your thoughts?
I was just going to say that the 1-to-1s or a higher CBD, especially with a more grounding terpene base, right, we are really seeing more testimonies with that.
Right, that's there. I hope that helps. I think, again, this was where a consultation will really help quite a bit. Are there any ways to incorporate tinctures into food or beverages to accelerate the onset or to intensify the effects of tinctures? Amy, you have some pretty good thoughts on this. I like your thoughts. Can you tell us what they are?
Sure. So for the most part, tinctures are actually meant to be administered under the tongue, sublingually. The idea is that you're going to get some absorption right away sublingually. So I usually suggest hold the tincture in your mouth for a minute, swish it around your mouth, and then go ahead and swallow it. That's actually going to give you the best and quickest absorption with that tincture. As far as foods or beverages, we always just recommend fatty foods, peanut butter, yogurt, something that has a higher fat content, because that's really going to give THC just a vehicle to ride on, pretty much.
Sure, that's there. Are there ways to incorporate? I think you also, when you talk about how to incorporate in them, I know when we did our cooking webinar, Sherry Cannabis was very clear to make sure that you stir the product well and make sure the cannabis is evenly distributed through the whole product itself. If you're making it yourself, that's there earlier. Please discuss the methods of inhalation, administration, low heat to preserve terpenes. Very good question. I know that when you get a pen, especially for vaping, it's really important that you have some temperature settings on there. A low, medium, and high, blue, green, and red, or low, medium, and high. Some of them have 4 temperature settings. I think this is really very important. Danielle, you want to take this one?
No, I completely agree. You want to stay under you want to stay under 500 to preserve terpenes, but they're better off around 300. But we have a lot of concentrate users that like to use that high heat for their concentrate devices, or their concentrate products rather. So they keep it lower than 500 to preserve terpenes, and you will hear the term waste it to taste it. And that's when they bump it up to 515 to get all the taste of all the layers of flavor, but you lose a lot of the terpenes in that.
Right. Yeah, I tend to keep it on lower temperatures to try to get as many terpenes as I can. But again, it depends on what you're trying to treat, because obviously each terpene addresses a particular condition, and you can the nice part about these pens is you can dial it in as to which terpene / condition that you want to address, which is very nice. Good question. I've been on Klonopin for 15 years. I have PTS and a horrible anxiety, terrified of being able to get off benzos. Will take any advice. You're first of all, being terrified to get off benzos. Look, you want to be able to treat this particular condition, and you want to be able to basically lead as close to a normal life as you possibly can, by fighting a lot of things internally. Amy, you have some military experience. You want to take that one and kind of comment on that?
Sure. So the biggest thing that I always recommend is have that open and honest conversation with the physician that has prescribed those medications to you, and establish a plan for slowly tapering down your doses. As you're tapering down your dose, that is where you might want to supplement with more cannabis products, maybe a 1-to-1 or something that is a little bit higher CBD to help with the anxiety. And a big thing with PTSD is finding terpenes that don't trigger you. Sometimes there are certain terpenes that can be a little bit more anxiety inducing. And so just figuring out what does or does not trigger you can be very helpful.
Sure. One other question is interactions in the brain when it comes to CBD, THC, and antidepressants. Question that used to be a avid smoker until antidepressants. Really, I'm going to go back to really the go low and go slow, but your brain has a lot of interactions, especially with THC. CBD helps a lot with the peripheral organs, and again with antidepressants. Amy, you want to address that, because I think it's important to understand that your CBD, THC works with your endocannabinoid system, which is throughout your entire body.
Absolutely. And the biggest thing with THC, CBD, and antidepressants is CBD and THC are connecting to specific places in your body, versus antidepressants, they are working on another part of your body. So these are different medications that are working in different ways.
Mhm.
So you might have found that when you started an antidepressant, it lowered your urge to smoke. That's a side effect of that antidepressant. But it's because they are working on different parts of your body. So it's just different signaling pathways that those things are working on.
Right. And I think the key is, don't go cold turkey. Try something, try it for a day or two, see how it works. With something else, try it for a day or two. You'll have different reactions, because again, every person's body is different, but you can get off of a lot of the antidepressants, especially if you're looking at either indica or sativa leaning products, depending on what you're trying to address. It really depends on your goals in your body. That's really something that really helps quite a bit there. Let's see. Next set of questions. got here? Okay, these are questions that we got from from the seminar itself. So Marcos had a great question. Is there word for equivalency or differences between ground flower compared to extracts, aka 1 gram of pre-roll versus vape and inhalation? Amy, you want to take this one because I think we kind of half answered this one. In fact, we might have completely answered it earlier.
Yeah, and it's kind of, there's no direct comparison because it's very hard to establish exactly what your dose is when you're using inhalation products. And that is because it comes down to timing more than it comes down to the actual dose of that product that you're taking. Your timing is your dose when you're using a vape or a concentrate.
Right.
So when you buy a 1 gram pre-roll, for example, it's going to tell you how many milligrams of THC are in that entire pre-roll. But if you only smoke a quarter of that pre-roll, you're kind of guessing that you're maybe getting a quarter of the THC that it said was in there. But again, it goes to how long your inhalation is and, you know, what specific product you're using, whether it's a vape or a concentrate.
Right. That's there. And again, concentrates will usually have a little bit more potency than urban flower because they are concentrates by name. So, let's see. Anonymous had a question, says works best with food. Is that meant to imply infused or eating foods along with your consumption? Yeah, you should. Cannabis loves fats. Is that right, Danielle?
Absolutely. Fats are the carrier.
Yeah. And it really is something to really take a look at. I think that usually using cannabis with food is really is really more effective than not. Is that correct?
Yes, absolutely. I mean, it's not saying that it's not going to work if you're not eating it with food, but you can totally use food to either extend or quicken the effects. Even some of your terpenes, like mangoes, have myrcene in them, and if you eat a mango about a half an hour before you indulge, it'll heighten those effects of the THC.
Right. Next question is a really good question. This is what method of consumption would get you the most terpenes for that strain? Flower, vape, concentrates, tinctures, edibles. Does heat and temperature affect the amount of terpene you receive? Let's start with the temperatures. The answer is the temperatures absolutely affect the amount of terpenes you receive. Your thoughts, Danielle?
Yes, we already talked on that. You'll
burn
them right off.
Yeah, we beat that horse pretty well. But I think really when it comes to the concentrates, it comes to the strains. I really think that tinctures, and in my case, tinctures and concentrates are really the best way to go. Your thoughts?
Well, any extraction is going to give you a little more medicinal properties to it because it's so pointed. You know, you're extracting this for specific results. So absolutely, the extractions, the concentrates, the tinctures, they're going to be your best source of terpenes.
Yeah, and I think the other thing is, let's not forget full spectrum products. Those are whole plant products, and they can help you quite a bit. So, all right, let's see what we've got. Next question, please. What chemicals are in marijuana? That is an interesting question because technically, when you take a look at cannabis, we don't talk about chemicals. Let's be candid. There's a lot of reasons why medical marijuana dispensaries like Surterra do 2 tests in-house and 1 test at an outside facility because they're testing to make sure there are no molds, there are no pesticides, there aren't any heavy metals and things like that in the product. So from that particular standpoint, you're pretty safe by taking a look at cannabis. Cannabis is comprised of cannabinoids, terpenes, and flavonoids. There are over 450 medical properties. We know there's over 120 different cannabinoids. In fact, there's 200 of them that have been found, 120 of them being studied. We know there's over 100 different terpenes, of which there's over 200 of them that have been found, and 100 of them being studied. So I don't know exactly when you ask what's in it. What's in it are the cannabinoids, the terpenes, and the flavonoids. And hopefully, if you buy from a medical cannabis dispensary, no chemicals. Your thoughts on that, Danielle?
Yes, there should not be chemicals in marijuana, period.
Right, right. I think that's what's important. When you buy products that are on the street, that's a whole different game. Okay. You don't know what's in them. And in many cases, there's horror stories of what's out there. I grew up in East Oakland. I grew up in an area that was, they did use cannabis and they laced it with a lot of things. So I dearly love the fact that we now have places we can buy products like dispensaries here in Florida that do the testing. That's really important. Bob asks, I would love to experiment with different forms of dosing. Can I replace anxiety and sleep meds along with neuropathy? I cannot afford the meds. Do you think pot will ever be included in insurance coverage? I'm going to take the last part of that, and then Danielle, let you take the first part of it. Regarding insurance coverage, again, because it's a Schedule I drug, the insurance companies, who are companies who do not like to pay no matter what, are using this as an excuse not to cover medical cannabis. And rightfully so. If it's a Schedule I drug, much like the banks, I don't think they want to be legally exposed. And I think that their lawyers will make sure that they stay on that. Now, there's a lot of discussion about removing cannabis from a Schedule I drug, depending on how they reschedule it, as well, whether you'll get medical coverage, insurance coverage or not. I do believe the day is coming within the next 5 years that you'll see insurance companies covering cannabis, but I don't think it's something that's going to happen this year. That's just my gut feeling. By the way, do you want to take the first part of this question about sleep meds along with neuropathy?
Sure, sure. Yeah, you can, Bob, you can absolutely get off of your pharmaceutical medications and replace them with medical marijuana. I think we pretty much touched on everything that you would need to know as far as that goes on how to do it. Definitely discuss it with your doctor, discuss it with your medical marijuana doctor, and have a planned journal like it's your job, and go low, go slow, and just try not to do too much with it.
Yeah, I think you can replace the anxiety and sleep meds. Again, it's a matter of, every person's body is different, but I know I've dealt with some patients who have neuropathy and they have been able to accomplish that. But again, they've gone low, gone slow, and they paid attention to the CBD to THC ratio to really figure out how it addresses their particular body and how it helps them. Once you find that therapeutic dose, it's amazing. I mean, when I found it, it was like I discovered gold. It really makes a big difference in your life, Bob. I think that's what you're looking for, and I think you should, if you head down that path, you'll find it. And again, a consultation with Surterra is going to help quite a bit. Amy asked a question: what is the temperature of disposable pens at Surterra? Do you happen to know that? You happen to know that, Forrest or Danielle?
I do not know that off the top of my head.
All right, so
Somewhere back here is telling me.
I'm gonna jump in here for a second.
Oh, thank
I
you.
did about a year and a half ago. I did a routes of administration, and I dug very deeply into the disposable pens in all the dispensaries. Most of the disposable pens that you'll find at a dispensary have a temperature or setting of about 395, between 375 and 395. That's where most of the pens really fell into. And I would be surprised if Surterra is any different from that. Your pen was about 395 when I checked it out. By the way, I had to go find out what pen you had. I had to go find out what manufacturer it was, and then I had to find out the specs for the manufacturer. And in many cases, I actually talked to the manufacturer about that. So they're not easy to find, that temperature rating. That's why it's kind of a loaded question, because it's not something that comes out very well. Your thoughts on that, Forrest?
Same thing. I when I saw it coming in, I went to look at all of our spec sheets to see if I could find it, trying to prep for it, and we have a hard time getting some of that too sometimes.
Yeah, and that's because some of these pens, when they come in, vary between 375 and 395, and that's why they don't really put the temperatures on there. But they're made by about 4 different companies, and they're made by one of those 4. So, or they should say they should be made by one of those 4. Not should be. They probably will be, because they're the largest manufacturers out there. But I would say using a range of like 390, 395 is probably what you're looking at. Monica asked, is this company will not ship to New York? Medical cannabis is something that you can't ship across lines. I mean, we're still having trouble shipping wine across state lines. But no, the answer is no. I don't think you can ship across state lines. In fact, I think it's illegal, at least here in Florida. And I know as long as if we have a federal prohibition on cannabis, I think unfortunately shipping across state lines isn't available. It is for CBD, but it isn't for cannabis. And this is where we need to do a lot of work to be able to basically get, let's just say, get our laws put back into a place where they're more reasonable. The next set of questions. Is there a way to test that what I make edibles for THC and CBD at home? Your thoughts on that? I think you have to take it to pretty much have to take it to a lab. Is that right?
You would have to hire a third-party lab.
Yeah. I don't think there's any home test there's not home test that I know of that can help you figure that out. Maybe there is. I don't know.
Not for specifics, something that could say yes, that it was there, but not to give you a weighted value to it.
Right. Karen asked a good question and says, the product slide shows most with higher THC. I am finding too much high with a variety of products I'm trying. Should I purchase a straight CBD product to offset this during the day? I need anxiety and pain relief while maintaining focus. Revive is working okay, but doesn't last long enough. First of all, I recommend that anytime you're looking at dosing with medical cannabis, have some CBD available, because what it'll do is it will offset that high or that uncomfortable feeling that you get from THC. So just a good standard practice is keeping a CBD product with you. Now, when it talks about which type to use, again, this goes back to how you react to CBD and THC. Your thoughts on that, Danielle?
No, I think you're absolutely right on the CBD. The Revive is working, but not lasting long enough. So I'm curious as to which line she's using there. I see
which
Amy
route of
had
administration,
posted,
because tincture drops will last between 4 to 6 hours. That smoking the vape pens will last shorter amount of time.
right.
The last 8 hours or maybe 3 hours. But the route of administration comes into play here as well.
Right. And Amy made a point earlier about distillate, and that might be a good option for that, because that is going to have a longer effect, and she would only need to use a tiny little bit of that. Sure. And she can still stay in the higher CBD product lines.
Sure. One of the questions that came up was, why is it that sometimes I feel the effect of the product and sometimes I don't? Amy, do you want to touch on that one? Because I think you briefly described why earlier today.
Yeah, and so this can be part of the biphasic effects of cannabis. It could be sometimes you're actually hitting that sweet spot and you have the dose really dialed into what you're trying to do. And then sometimes your dose isn't quite there. Sometimes if you go slightly over, you might find that the product is not as effective as you were expecting it to be. It can also depend on if you've recently taken a break from cannabis, if you've taken a cannabis holiday, and if that's reset your endocannabinoid system at all. So there's a lot of different factors that go into why a product may or may not work specifically like you want it to every single time.
Right. Anne asked a very good question. Has Surterra discontinued the 19-to-1 tincture? Danielle, your thoughts?
Forrest, yours? This question we get asked almost every day.
We have not, and I use it almost every day. Tranquil is the name of this product. Wonderful for anxiety, for anybody who suffers with anxiety like myself. Keeps high CBD number, low THC number. Great product to use throughout the day. Sometimes it is not always in stock, but definitely is a product of ours.
Yeah, my wife uses that product, and I have to tell you, the issue isn't discontinuing. The question is, it's an extremely popular product, and I think the biggest issue is keeping it in stock. Is that safe to say?
It is impossible to keep it on the shelf. We get it in, it's gone by the end of that day, 95% of the time.
Yeah, I think it's just a very popular product, and again, because everything's botanical, it takes a while to wrap up the production. It's there, but I think look for it because it is going to be there. Would there be any recommendations on a tincture that would help with migraines? Danielle, you want to take this one? Because migraines, they have found, a couple studies in the last couple of years have shown that migraines are directly related to the endocannabinoid system. Do you want to address this one?
Oh, we're finding so many people having the higher CBD sativa type aspect is really helping them with migraines, just opening up the capillaries, letting that blood flow, getting oxygen there. The Serene is a beautiful product for that. We also have a couple of 1-to-1, the Super Glue and Flaming Cherries. The Flaming Cherries is another beautiful product for that.
Right. I like the Super Glue product, by the way. I would highly recommend that one. I think that's pretty cool. So right there. Question: how do I correctly dose when taking antidepressants that already boost my mood? Amy, you want to take that one?
Yeah, I think it's just, again, starting at a very low dose and then gradually working up to a dose where you're seeing the benefits that you're looking for, but without unwanted side effects. So if you, it also depends on what your goal is for using the product. Are you looking to use a product to help boost your mood in addition to the antidepressant? Then you would definitely want to assess how you're feeling as you're using the product, and is it doing what you want it to for you?
Right. Susie asked a great question, and this is really a terminology question. Is marijuana considered a psychedelic? And it really goes back to what is a psychedelic. I can tell you medical cannabis is very much a holistic product. It's been listed as that for a long time. Yet I know that there's a lot of conventions going on right now and a lot of talk about psychedelics, and they're getting cannabis people to attend a lot of those conferences. I know there's one coming up this month. It's in St. Petersburg. What's your thoughts on this, Danielle?
I mean, it just goes back to exactly what you said. I would not classify it as a standard psychedelic. There is psychoactive properties to it, and I think it really just aligns with what your own terminology for psychedelic is. But as far as a standard psychedelic, no, there's no hallucinogenic properties.
Right. I think I would look at it as more holistic than psychedelic. But again, the definition really comes into play. What's really important is it does help, and that's what the key is. It's there. Ali asked the question: why do I react differently to THC now that I'm taking antidepressants when before I could smoke any strain, any strength without freaking out? Amy, you want to touch on that one?
Sure. So it might just be finding a product that is not giving you anxiety. It might be starting with a high CBD, low THC product. It might be looking at terpene profiles. You kind of have to drill down to what is triggering that freak out, you know? Is it the amount of THC? Is it a certain terpene? So it does take just some trial and error to figure out a product that is not going to make you, quote unquote, freak out.
Right. William asked a great question. Someone told putting indica FSO in the belly button connects to many major nerves in the body and really helps with this with internal pain. Do you have any additional information on this? I've heard about this, Amy, and I read a little bit about this when I was studying and getting my degree. Do you want to address this one?
So this is actually one that I am not super familiar with. I've never really heard this specific one, putting it in your belly button before. You might get some localized relief to wherever you put it. Because FSO is a full plant product, you can use it topically or internally, like orally. So this is a new and different one. Danny, do you have any?
Yeah, so I love that this question was asked. So we have so many people that really believe this is their regimen. This is what they do. And it's very similar to like putting something on the bottom of your feet and having that take effect. I challenge you to put like some lime or something in your belly button and you will taste it. I promise you will taste it. So yes, absolutely. This will help. I don't know about FSO. That sounds like it would be very messy. Maybe using a carrier oil with that or just using a tincture.
Well, I've heard of this, and I think there's a lot of anecdotal research, a lot of anecdotal stories about this. I have not been able to find any research on it. So I can't, from a research standpoint, say yes or no. I have heard it does things. Again, it's all anecdotal. And right now I would leave it in the anecdotal category. We can't really give you a good answer other than, you heard from a friend, and we kind of heard from a friend. I've never done it, and I don't know of anybody who has. So I guess we'll find out. William, you also mentioned the terpenes that trigger PTSD. You mentioned the most popular culprits. One of mine traces of, well, anyway, the biggest culprit for a terpene is pinene. I highly recommend that if you have PTS, that you really stay away from pinene. Your thoughts about this, Danielle?
Absolutely. That was what I was going to say as well. Pinene, a lot of the terpineol, those tend to be a little bit of a trigger for PTSD, especially.
Right, right. Now, I think the last question that we had come up is, what do you think of dry flower vape? I am a huge fan of dry flower vapes. I use them. I really recommend them. What I love about dry flower vapes is that most of the devices in fact, almost all devices that you get, you can either set a low, medium, or a high, or you can set it right down to the actual terpene. Let's just say the actual temperature itself. I use a Stokes and Bickle. That's extremely expensive. It's a Mercedes-Benz of the dry flower vape, but I can set the terpenes. I can set the temperature right down to the actual degree. I know that some of the concentrate pens that are being brought out from Surterra have that feature as well. But I'm a huge fan of dry flower vapes. Your thoughts on that, Danielle?
I couldn't agree more. The dry flower vapes are really probably one of the safest way to vapes for your lungs, of keeping the heat from entering there. And then you also have that ABV when you're done, and you can make milk and honey and all kinds of fun stuff with it.
Yeah, my smoothies love it. I was just going to mention that you can use the product afterwards. You can use it in things like smoothies and that type of thing. It's really, I'm a huge fan of that. And I really recommend using a dry flower vape versus just using a blunt, because once you light that blunt, you're brightening up by getting rid of half of the cannabinoids, almost all the terpenes and all the flavonoids. Or using a dry flower vape allows you to get the best medical efficacy from the product that you're purchasing. So I hope that helps quite a bit. I think we've exhausted most of the questions. Let's see, since CHS is on the rise, can you suggest ways to prevent too much THC when doing concentrates? You want to take that one, Danielle?
So I'm not sure what CHS is.
Cannabis hyperemesis syndrome.
Okay, go ahead, Amy, then.
Okay, so the way that you would want to avoid CHS, it's really when your body is overloaded with THC. If you are using concentrates, it's really going to come down to watching your dose. And again, using the lowest possible dose to get the effects that you're looking for. So it might not be that giant dab of wax that is going to get you super high, because that may trigger CHS. It may or it may not. We don't have great information on what specifically causes CHS, other than it seems to be high levels of THC.
Right. Yeah. So anyway, the point is that you really have to, let's just say, pay attention to what you're using and pay attention to how you're using it. I think that's the best advice. Is that safe to say, Amy?
Yeah, it's just paying attention to what you're using, how much you're using. The thing with CHS is we have not found a way to predict it. We can't really predict who's going to be affected by it, when they will be affected by it. It just comes on very suddenly for some patients, or some patients may find that they just start getting like nauseous and they start vomiting, and it may only happen every couple times that they use any cannabis products, or they may find that it's just very sudden. They started having uncontrollable vomiting. The problem is, again, we don't have a way to predict who or when it's going to happen, but it does seem to be related to high doses of THC. So with using concentrates, just really, really watch your dose.
Right. Ali asked a great question. Where can I go back and review this live webinar? Ali, I would please have you go to, first of all, there's two things that come into play here. After this webinar, you will receive an email, and in that email will be a link to our YouTube channel, and it'll also give you a copy of the presentation in flipbook format and a lot of the different supporting material that we use to put this together. Now, on the YouTube channel, you have two different areas to go. One area is you have videos about the actual subject itself, like dosing. And then there's another area where you can actually review the live webinars. That should be out by early next week. We should have that video posted. And when you go to the live webinar part, go to this webinar itself. If you go past the actual video that we presented, then you'll get to the webinar section and you'll be able to get the Q&A that's in there. So the answer is our YouTube channel. That YouTube channel is Marijuana Aware. So it's YouTube at Marijuana Aware. And you'll be able to find, I'm sorry, marijuana. Yes, hold on here. It's Marijuana Aware. You should be able to find that channel that's out there. I will, again, when you get an email from us, it'll link you right to that YouTube channel and you'll be able to find it. And I should point out that if you're looking for a medical marijuana card, the medical marijuana treatment clinics of Florida will be able to help with be able to get the cards. Naturally, if you're looking for products, I recommend Surterra Wellness. Not just because they sponsor this webinar, but I've been using Surterra products for a long time. And I really like the product quality, the capability to get the ratioed products, and more importantly, the consulting that they do. That's great. And then, of course, if you're looking for just CBD products, My Botanical Wellness is a source for that. Final thoughts of Forrest and Danielle. What's your final thoughts?
I'm just super grateful that you guys provide this. I'm really grateful that you provide this. I think this is a beautiful experience for everyone, and to be able to be at home in their safe space and be able to log in and get the information that they may not be comfortable coming out to get, or just having the convenience of it being in your own home. So
Sure.
Thank you very much.
Danielle, thank you for some great comments. Forrest, as always, great comments, and we really appreciate the support that Surterra has been giving.
Absolutely, really happy to be here and continue doing this.
Right, and again, if I can't promote anything, it's not only just the ratio products you have, but the consultations really make a big difference. Amy, your thoughts? Wrapping up.
As always, I really recommend using a treatment journal, especially for new patients. During the webinar, there's actually the treatment journal that was on the screen. There is a link to that treatment journal. It's just something that's a tool to help you figure out what your dose is, right, and to go from there.
Great. Yeah, I think journaling we can't impress. I mean, I wasn't a big journaler, I should say, until I really had my knee operation, and really it was something to help me quite a bit. I want to thank everybody for joining us, not just for this webinar, but for the whole webinar series for this particular quarter. This is the last one from our Q2. I do have to mention we're going to be starting a summer webinar series. Next week we have concentrates, right? Right, Forrest?
We do. We actually have some special guests on next week. Some of our extractors, our senior extraction team, and some exciting news to share with you guys next week.
And some new products, right? Or some newly formulated products that are there. So please join us. I know we have. We're not going to be doing as many seminars over the summer. We'll be doing 5 of them, but concentrates are next week, and the week after is edibles. So please come and join us. I want to thank everyone. My co-hosts, thank you for this. A couple of people in the background that really make this happen, which is Lee Jones and Leah. Thank you very much for the work you've done. More importantly, I want to thank each and every one of you for joining us for this particular webinar. Please go to our YouTube channel, not only just to check us out, but please subscribe. We want to be able to provide a vehicle that gives you the medical cannabis information that you're looking for. And please feel free to subscribe to our channel and give us feedback on that channel. Use it as a communication mechanism. Thank you all, and I hope everybody has a great 4th of July weekend. Thank you very much.